friends, it's Dr. Erin. I'm home today and I'm seeing a lot in the news about medical weight loss drugs. I just had a candid discussion with my team about what doctors really think about these drugs, who should be using them, who benefits, whether or not they're harmful, and how to transition off of them. So here we go. Take a listen to my take on Ozempic.
Drugs were initially marketed for type 2 diabetes. So the primary thing they do is treat type 2 diabetes. And as a happy side effect, they started noticing that, whoa, people were losing a lot of weight. So now a lot of them have been repackaged and kind of remarketed as a weight loss drug. If you're overweight and you have type 2 diabetes, this might be a really good idea for you or not. So we're gonna talk about that. So what do? They suppress your appetite. These are called glucagon-like peptide 1 receptor agonists, GLP-1 RAs. GLP-1 is in the brain and it's also in the pancreas. So at the pancreas level, it increases your insulin release. So in that way, it works a little bit like metformin. It causes your insulin to go up. At the brain level, it suppresses your appetite a lot. And sometimes people don't like that effect. So the two positive effects that come from that lead to weight loss and a lowering of your hemoglobin A1C, which unless you're diabetic, you might not know what that is, but that is your long-term look at your blood sugar. So it looks back about 3 months and you want that lower and lower and lower. We like that to be completely out of range of diabetes, which we're capable of achieving with a low-carb diet.
Stop right there. I just said a low-carb diet can do the same exact thing as these drugs. A low-carb diet is exactly what I teach. And yes, we create the same magical weight loss and can reverse your type 2 diabetes with no side effects.
The downside is that there's many things to consider, okay? The downside, they're very expensive. Right now, even with coverage, they are like $1,000 a month. And without coverage, they're like something like $1,600 to $1,800 per month. So very expensive. You have a dependency for life, and often your dose goes up. So you get a little bit tolerant of these things. So what started as $1,000 a month kind of commitment may over time become a $2,000 a month commitment because you need a higher dose. If you use it and it starts working, wonderful. But if you stop it, you're going to go right back to where you started. There's some pretty bad effects on organs, which are low risk or rare, but you should certainly know about these. And I don't know that all people are being told about this. So because it affects your pancreas, it can cause your pancreas to go crazy on you, pancreatitis. And anyone that's had pancreatitis would not wish that on anyone. It can also wreck your thyroid. There's also a depression effect that's starting to be more and more talked about. And that's probably multifocal for many reasons. But more and more people who have been placed on these drugs are reporting depression, being treated for depression, and there's been a lot of suicides associated with the start of these drugs as well.
Stop right there. Nobody is talking about this factor enough. When you take people that previously really enjoyed food and all of a sudden make it completely unenjoyable and inaccessible, you take away a lot of their happiness. And some people even lose their ability to socialize around food.
And that may be part of the depression that goes on with these people. Some people actually report that they're depressed, that they can't eat normally anymore.
Hang on, we're just getting to the side effects.
The side effects are not small. They are huge. And most of the side effects are on the gastrointestinal tract. So for most people that start this drug, they have extreme nauseousness. Many people who are started on it are vomiting nonstop and just have zero appetite. So they kind of just stop eating. And that's where all the weight loss comes in. They're just not eating. Aside from that, there's a lot of other things reported like anxiety, there's hair loss, there's rapid heartbeat. So, look at the list on the right. This is like the stuff you see on TV, right? It's like, we'll do everything for you except for watch this 5 pages of things that could happen. So, but the majority of people, if anything bad happens, what does happen is the nausea, the vomiting, the diarrhea, and the just overall feeling of like, I don't feel great because I'm not eating. So they feel kind of wiped out. So there's these starvation effects.
Yeah, starvation effects. That's called anorexia. and anorexia is not really good for the body.
So this complete loss of appetite, though, leads to a particular type of weight loss that is concerning, particularly for older people. So because they're not eating, they're not getting enough protein, they're losing about 50% fat and 50% lean tissue.
Stop. 50% of the weight loss is muscle, bone, and organ tissue. Not good.
Which is not good. So that lean tissue, I promised you that we'd talk about Ozempic face, right? So the more I studied and heard about this stuff, I was like, what is Ozempic face? So you'll see everything out there about Ozempic face, including, I love my Ozempic face because they went from like big heavy face to like thinner face. Okay. So there's some people that love their Ozempic face. And then other people that are saying, I hate what Ozempic did to my face, which is really what we're talking about when we talk about Ozempic face. And now there's like practitioners out there who specialize in reversing Ozempic face, which just so you know is like, get off the drug and start eating protein. So that's what that's all about. But Ozempic face is like a hollowed out, it's supposed to be, when people prescribe this stuff, they say that they can recognize people who are staying on the drug or have been on it for a long time just by looking at their face. So they get this hollowed out appearance and they start to look prematurely aged with lots of wrinkles. And I know if my mother were on this call, she's not here tonight, but if my mother were on this call, she'd be like, yeah, every time I lose weight, I don't like it because it makes me look older. It makes my wrinkles come out. I like to have a little plumpness in my face. And I get that, any weight loss will cause it, but this is a little different. This is loss of structure, loss of collagen. You're losing all the landmarks in your face. So you see, Sharon Osbourne here, she's probably the most famous example of what is Ozempic face, because she's talked about it on her little daily show there, like that she just went skeletal. And that's what it is. It's kind of like a look of all of a sudden, I don't have any muscle on top of my bone. You just start to look skeletal. But this is the biggest concern for people that are menopausal and beyond, because we've talked about this in the past, that it's harder and harder to regain lean tissue that you've lost. Once you go on something that wipes out your lean tissue, it's really hard to fix this problem. So here's another example. Wegovy, by the way, is the same as Ozempic. It's just a double dose. So Ozempic was the original type 2 diabetes drug, and Wegovy decided like, oh, the weight loss effects are so great, we're going to remarket it and actually give a higher dose. So Wegovy is a double dose of Ozempic, but you don't hear about Wegovy as much because when people start Ozempic, a solid 1/3 of people quit within 2 weeks because they just don't like it. They're throwing up all the time. They don't like it. But for Wegovy, it's greater than 2/3 quit, because the higher the dose, the more the side effects. So they thought going high dose would help people lose more weight, and it did, because they had tons more side effects that were not cool. they were not liking it. So if you ask me, should you be on this as a jump start? If you had a plan, like if you're not losing weight, you're so upset with what's going on, you have terrible diabetes, or you've just tried everything, you're frustrated, this works really fast. So as a jump start to learning a healthy diet, like if I were to prescribe it, which I'm not going to, if I were to prescribe it, I'd be like, sure, okay, try this. And as you do this, I want you to start learning about healthy eating. And it kind of is going to force you off of the drug over time, because you can't really do the healthy eating that I'm suggesting if you stay on this drug.
So bottom line for me, friends, a patient would have to be desperately overweight, extremely unhealthy, be in a very high-risk category for metabolic disasters related to their weight, or have severely uncontrolled diabetes for me to say this is an acceptable choice. It's very similar to how I would prescribe bariatric surgery or weight loss surgery. I only recommend that as well for people who are in a very desperate spot. Thanks for hanging out with my Emergency Health Fix SWAT team today. I hope you learned a lot, friends. And hey, as a reminder, this is what I do. I'm an expert in metabolic health. If you want all the positive effects in terms of weight loss without the negative effects, if you want to remain happy, energetic, and strong while you're making progress with getting healthy, call on me. I can help you do all of that. Learn about all the different ways you can work with me on my website at emergencyhealthfix.com. There you can hop on my email list and receive instant discounts. There's a free blog on my website with loads more free education. And make sure to subscribe to me here so you don't miss any new videos.